the big why. So functions of rubber dam is to give us a headache, I guess. I don't know. If you don't master it, it gives you a big headache. So these are the 7 functions. Of course, there are more functions. We just touch on 7 functions. The first function is isolation, is to maintain a clean and dry working feel. So it improves bond strength of any bonded restoration. What are bonded restorations? It can be indirect restorations or also direct, such as your regular composites. They're also bonded. And it removes the tongue, cheek, and saliva from the field of work. I think this is the most advantageous part. There's no tongue, there's no cheek, there's no vestibule, there's no saliva coming from anywhere. One thing to note, if you use the black dams, if you see in this picture, you can see a lot of debris around the dam. So sometimes when you take photographs, it doesn't look that great. I guess if you clean the dam, it will look nicer. Yeah. So number 2 is retraction. So you can retract the interdental papilla and also the gingiva for deep caries. Number 3, it improves the visibility and the access. So you get a clean and clear and dry working feel. You don't get distracted by the tongue, the cheek, or what's going on. And it's more focused on the tooth. So you'll improve your efficiency and you have quicker workflow. So Nani, reduce operator stress, really? This is debatable depending on how skilled you are at placing the rubber dam. Maybe initially it will be increase operator stress, but over time maybe it would decrease the operator stress, yeah? And reduce operating time, really, yeah, sometimes even I take some time to place a rubber dam, but yeah, keep practicing and it would definitely, once you master it, you just place it in 1 minute, max tops, and invert it maybe 2 minutes and then you're done. Everything becomes smooth after that. So yeah, I love this meme that I found. Rubber dam is on and looking good. Half the appointment is over. Yeah, true. We're like 1 hour, half an hour is over. Number 6, containment of irrigants. So you can see blood and pus oozing out of this canal. Contained by rubber dam. I'm sure the pus does not taste very good. So only by using the rubber dam, you can use sodium hypochlorite, which is the gold standard. Otherwise, like in government, those days when I didn't use the rubber dam, you have to only use saline. And saline just flushes out the debris. It does not actually kill any microorganisms in the root canal system. And hypochlorite is, of course, dangerous when swallowed. And, a lot of things can go wrong. Number 7 is securing the airway and the GIT. So as you can see from this X-ray, you can see a file that is swallowed. And we all feel it won't happen to us, You feel like, you're doing root canal in the government. I mean, I used to do root canal without rubber dam, but I actually bought my own set to use in the government because I feel, you shouldn't let the lack of material stop you. Just buy. I mean, okay, I can't say everyone has enough funds, but, try to invest a bit and it will go a long way. We all feel it won't happen to us exactly what this dentist thought. It's like, oh yeah, I can try, just file, and then suddenly happens. So I also have a personal experience where I think it was a size 15 or size 10, you're trying to negotiate a canal, and then suddenly the next thing the file just slipped from my hand and it was at the back of the patient's throat. It was like his tongue, and it was like right at the back. I'm like, oh my God, he's going to swallow it. I'm like, sit up and spit it out. And thank God he spat it out. It's like, wow. I'm like, oh my God, I can't forget that experience. So why is swallowing a file more dangerous than swallowing a crown? This is not a quiz question. Don't kanchong, don't get excited. Later I will show you, it's a big slide saying quiz. So why is it more dangerous? It's more dangerous because the file is sharp. The file can get lodged somewhere in your airway or GIT, and most of the time it would need a surgery. While if you swallow a crown, if you're lucky, within 2 days, it will like bloop, come out the other way. And of course, it improves endodontic treatment because when you have no fear of the file slipping, you have increased tactile sensation. So when you have increased tactile sensation, you can negotiate the canals better. You won't make any, you will reduce chances of procedural errors like ledgers, transportation, and so on. In dentistry, we need to have a sequence, like a repetitive sequence that we can always go back to. Like, you know, when we're doing a crown, we need to have, okay, in our mind, okay, we need to have the putty ready, and we need to have, you know, we need to get our burrs ready. Then we need to cut, we need to temporize, we need to take impression kind of thing. So even rubber dam, you have a sequence. If not, means it's very serabut in Malay, very kelam kabut, or very, you know, you don't know what to do. I don't have my I don't have my marker pen, and then you'll be like, oh man, can you get my marker pen? Then you got your punch, then your dam test. You only took out one dam. Oh, you need to take one more dam. So yeah, you need to have a sequence. So this sequence needs to be repeatable. So I think the most important sequence, number one, is to determine which teeth to be isolated. Let's say you're doing endo. So endo, you know, only one teeth you're going to isolate. There's not a class 2 cavity, it's a class 1. So you'll be like, okay, 1 tooth. Okay, let's say the endo has a class 2 cavity. Let's say it's a 4-6 and it's a deep class 2. And okay, maybe you want to isolate 3 teeth. So you go 4-7, 4-6, 4-5. Or maybe you'll be like, okay, I want a wider access. You'll be 4-7, 4-6, 4-5, and maybe a 4-4. So you determine which teeth. Okay, I want to isolate 4 teeth. So number one, you have determined in your mind. So number two, you mark the sheet and you punch. So this depends if you want to mark it outside or inside the mouth. So these variable techniques outside the mouth using the template, or some of you all who are more experienced can freehand mark the sheet. Or you can mark it through the mouth where you put the dam on the frame and you put it in the mouth and you mark the 4 teeth that to be isolated. Number 3, you need to floss through the contacts. So this is very, very, very important. Before you put on the dam and all, you need to floss through the contacts. You need to check any interproximal issues. Sometimes there might be an amalgam that's overhanging into the cavity. Let's say a 4-6 MO. You want to do RCT, and the 4-5 amalgam is like, you know, into the contact and overhang. You need to use your burr to smoothen that out. Or sometimes the amalgams are joined together, or, you know, you need to know how tight is your contact. If the floss does not go into the contact, your dam will not go into the contact. It will tear, and then you need to be like DJ Khaled again, another one. So number 4, choose clamp and try on the tooth. Sometimes you're quite confident, you can skip this step, but if you're not so confident, take the clamp, put it on the tooth, ideally with safety ligature, but most of us don't use the safety ligature, not good. But use the safety ligature or the floss, put it on the tooth, check the dam stability. So once your dam is confirmed, your sheet is punched, your contacts are open, and you know which teeth to isolate, so then you use your variable techniques. Whether you're going to put the clamp first, then the sheet first, then the clamp and the sheet together, or the clamp, sheet, and frame together. That one is up to you. We will discuss more later. So after you have placed everything in, your clamp is in, your clamp is in, your dam is in, your frame is on, floss through the contacts, invert the dam, if needed, floss ligature, and then leakage control. Put some water, see if any leakage, okay? So anterior teeth isolation. So usually done from canine to canine, or you can do single tooth for root canal treatment like shown in the photo there. It may be clampless isolation. So you can see in the photo on the upper right part, the black thing is actually just a rubber dam. I just took it for the photo, but actually it should be same colored, because you just cut the edge of your rubber dam that you're using and just, you know, floss it in, and it keeps the dam in place. Okay, sometimes you don't even need a floss tie. Dam punch. So floss tie sometimes needed, and you may also utilize the split dam technique. This also we will address in a future webinar. We'll teach you how to do a split dam, and also in the rubber dam courses, definitely we'll teach you how to do this. So marking of the sheet using a template, or you can mark the dam intraorally, or the third one freehand. So normally about 5 to 6 mm apart. So once you have memorized this, so-called memorized, you can just freehand mark it, okay? So this is a video. I don't know how clear it will be, because most of the time when we stream, the video is not very clear, but let's start. So this is how to mark and punch using the template. So you want to isolate 4 teeth, you mark it, and you take your punch. This is an old video, so the punch is like the older one. This is sanctuary black dam. So if you can see, there's a rubber dam tag there. See, this is my old puncher. Yep, punch and punch. Okay. Yep, those are the tags. Okay, I'm not sure how clear the video is. If it's not clear, I apologize. This is how you mark intraorally, meaning sometimes the teeth are crooked or malaligned. So you put the dam on the frame. So you put it on the face and you stretch it into the mouth. So this one, of course, you don't have a mouth here, but you want to stretch it into the mouth and then you mark 1, 2, 3, 4, marked in the center of the tooth. Okay, on the occlusal surface in the center of the tooth, mark 1, 2, 3, 4. Let's say, see, I use the 4th hole. Yep, okay. So floss ligature. Okay, this is also another hot topic which people will like, how do I do? There are basically a few ways to do. I found one way the most easy or the easiest way to do. But of course, there are other ways which I heard is better. So we'll look into that. So basically, it helps to retract the dam apically and it secures it. It looks difficult, but once you learn the technique, it's so easy. You can do it in like 5 seconds. Okay, not 5, maybe 10 seconds. So this was me and Dr. Gria, one of my earlier Teeth Talk Tuesdays episodes. I went for the Pasa Dent event, Dent Talk, where we did a video together. And so this is the video on how to do the floss tie. I'm not sure if it's clear or not. So what floss to use? So floss I'm using here is a Colgate floss, but any floss that is unwaxed, okay, unwaxed floss. The floss to floss your contacts should be waxed. The floss to do your floss ties should be unwaxed. I like this Colgate floss because it's made of material, something like Teflon, kind of Teflon material. So I like it quite a lot. So one loop and the same thing, you just repeat it again. Yep, one more loop. So if you guys want to see the video, it's up on my Instagram. I mean, quite an old post. I can repost it again. The clearer video is on my Instagram, okay? So this is how you make the loop. And you place it on the tooth. And you need to put a plastic instrument at the palatal aspect. Yeah, where my thumb is, my left thumb, that's a plastic instrument. And you just pull to tighten, okay? And how to remove. Just use a probe. I'm using an endo kind of, yeah. I can use any probe to remove it, yeah. So, okay, now clamp placement and stability test. So what is this actually? How do you test your clamp stability? What do you mean by testing the clamp? Just now we said we put the clamp on and we test it. How to test the clamp? So first, how to place the clamp. So the technique is we engage the lingual or the palatal side first. As you can see in this photo, the lingual part or the palatal part is engaged, but the other side is not engaged. So you slowly rotate the buccal side past the height of the contour and towards the cervical margin. So this is very, very important. You don't just let go both at once. You can impinge or you can clamp the gingiva. So do it slowly. I have a video after this. So clamp stability test. How do you check? Two ways to check. One is to rock the clamp buccolingually, and one more you push from a distal to mesial. Like imagine the rubber dam, right? So if you have a clamp like this, the rubber dam will be from the back and you'll be trying to dislodge it to the front, right? So you try to do the same thing. Okay, watch a video, okay? Video on clamp placement. So palatal again. And then the buccal side, you rotate it in slowly. Yep. Go more apical slowly. Yep. And then you let it go. Okay, done. So now you do the stability test. buccolingual, check if it's firm, and also from distal. So you pull it, yeah, see whether it like flicks off, flies off, because the dam will be from the back, yeah. Okay, how do we place a dam? So credit to Dr. Griya. I mean, I haven't seen this technique before he made it more popular. Because normally what we do, we punch the holes and we try to put the hole, I mean, the tooth is there, we will just stretch the hole and put it in. What he does is he stretches the interproximal dam region. So he stretches in between the teeth and he like flosses it in, which is like, wow. When I first tried it, I was like, wow, what a genius, you know. I don't know where he learned it from, but amazing technique. I'm not sure if you can see the video again, but yeah, basically you stretch and place. You stretch and you place. Place and you stretch and you place. So yeah, just like that, you know, interesting. So okay, this is also another special technique which I learned from Dr. Ashwin and Dr. J, which is called clamp, rock, and dam release. Okay, so this I've not heard anywhere. I mean, the first time I heard is from them. A special technique of releasing one side of the clamp while retracting the dam sheet apically. So basically, why do we do this is because your clamp is clamping on the dam. So you want to release it. So come, I show you a video again. I'm not sure if you can see, or you see your clamp is on the tooth, but the dam is not on the tooth. There is a gap. So we open one side. Oh man, let's play again. So you can see again here, right? So if you can see on the left hand side, the dam has seated in. And then you open one side. It's not very easy to take a video of this. So basically what you do in this is you use the forceps on the tooth and you open one side. Like you keep, let's say you keep the lingual part of the clamp engaged on the tooth and the buccal side you open. So using one hand and simultaneously you let the dam, pull the dam apically and let it go. So the dam goes to the cervical part of the tooth. And then you do the same on the other side. Okay, a bit difficult to show on video. So then you have the 4 methods of placing the clamp and the sheet. So the clamp first, the dam first, the clamp and the dam together, or for endo, most endo, clamp, dam and frame together. So okay, this video is for the clamp first. So as you can see, the clamp is already on the tooth. You stretch the dam over the clamp. So this one is a bit difficult, but it can be done on your own. You don't need an assistant for this because as you can see, it's self-explanatory. You can place it yourself. The only thing is that it's a bit difficult sometimes to stretch your dam over the clamp. I don't like this technique. It's just a hassle, but the good part is that you don't have a dam. So when you put your clamp in, you can visualize which tooth you're actually clamping. That's the only good part about this, I guess. So don't forget the floss, the contacts, distal to the dam, mesial to the dam, you know, everywhere. Okay, I'm not sure how good the video is again. I'm sorry. Okay, so this is the dam first. So self-explanatory. So this one, you put the dam first. I'm sorry for those who are raising their hands. I hope that Sanctuary and Yasmin can message them or something. Okay, so this is the dam first. Then we place the clamp. This one a bit difficult if you don't have an assistant, because if you see the video again, after we place the dam, and when we want to place the clamp, right, your assistant or you yourself have to retract the dam on the anchor tooth. In this case, it's a 4-7. So you have to really stretch. If your assistant is trained, I see I'm stretching. Yeah, I'm stretching. Can you see the gingiva there? So if your assistant is trained to place rubber dams and to stretch a tooth, they can stretch. Otherwise, they'll be like, oh, don't know how to stretch, and you need real force to stretch the dam down and to place the clamp on the tooth, okay? Clamp and dam together. So this can be done with a winged or a wingless clamp. As you can see, it's a wingless clamp here. Most of the time it's done with a wing clamp. So this is called a parachute technique. So you'll see why. So this is using clamp and dam together with a wingless clamp. So you place it on the bow and it becomes like a parachute. See, like wee, it's like parachuting down, okay? So now you have the jaws exposed. Take it to the tooth. It's a bit difficult to see though, this one. You have to be careful. Clamp the right tooth, okay? It has happened before, clamping the wrong tooth. So clamp, very easy, nice. I mean, this is nice because the dam is going to the patient's throat. But yeah, otherwise it's a bit difficult. Just stretch a bit over the jaws. And yep, I kind of like this technique. You can also do it on your own, okay? You don't need much help from your assistant. Sometimes assistants are busy and so on, so it's a bit difficult. Okay, so then you're done. Don't forget to invert the dam. So then we come to the dam, clamp, and frame all together. So this one can be only done with a wing clamp. So here I'm using the polycarbonate clamp, but any wing clamp will be, you can use any wing clamp. So if this one, you have to make sure which is the tooth because you cannot see what tooth you're clamping. So better be careful. After you have clamped it, don't forget to floss. And also, yeah, this part, if you have the slot, will be easier. Okay, yeah. Get the dam down. Now you need to clamp rock. Can you see the gingiva there? So we need to clamp rock. Yep, one side is done. Now the other side. Okay, cantik. Okay, we're done. So this is for endo mainly. So basically it's just a fast setup. If you have trained assistants and you can tell them, okay, I want a molar. So then they know your favorite molar clamp. They will just punch, they'll place the wing clamp in the hole and they can set up the frame. So all you have to do is, okay, you want a forceps now, you just take your forceps, get the clamp, put on the tooth. So I mean, that's ideal, but yeah. So my preference, multiple teeth, the clamp and dam together, like I said, or the dam first. For single tooth, of course, clamp, dam, and frame together. And then coming towards the last part, already 1 hour plus, 1 hour and 10 minutes, the dam inversion. What is that? It's inverting the dam into the gingival sulcus. It is important for optimal seal. It's only possible if there's no tension on the dam. If your dam is so tight, there's no way you can invert the dam. It will just pop out. If the holes are too near each other, if the teeth are so far apart and your holes are near, it will be stretched out. So there'll be a lot of tension. How to do this? Very important to have an assistant here to blow air using the 3-way syringe. Blow air to dry the dam and the tooth while you use your plastic instrument and go against the sulcus. So you must remember that the sulcus and the dam must be dry, the tooth must be dry, while your plastic instrument can be wet. How to wet? I mean, I don't know where I heard this before, but you can use it. We can use the patient's saliva. So basically, just like dip it. It's quite disgusting, right? But yeah, it's a tip, okay? So alternatively, you can use a floss ligature, okay? So this photo is from Style Italiano because I don't have like beautiful photos, and their photo was like so like bomb. Okay. So let's see how to do it, okay? So I don't have a 3-way syringe here. I'm just packing it with my plastic instrument. So this will create an airtight seal or watertight seal because the dam actually goes into the gingival sulcus and that just makes it, watertight. Otherwise, if you don't invert, the saliva would just seep up through that part, man. It would just come up and your whole cervical area will be super wet. And it'll be disgusting. And it'll just like, make everything messy. So basically just pack. Dr. Celine uses a sickle probe and runs it across. I haven't tried that before. So far I've been using a plastic instrument, but she seems to have a lot of success with the sickle probe. Okay, just be gentle, okay?